are heard. Speak harmony where knowledge meets community.
I can't sing. I wish I could. So many times I wish I could dance, but I can't sing. But we welcome you. Welcome to another episode of the Speak Harmony podcast. Wow, we are so blessed to have this guest in the house. But before we go into all of that, we want to shout out our amazing premier sponsor. He is the sponsor of all sponsors right here in the ATL, APAT Media Group. Okay, so we just want to thank you, Mr. P, as usual, for being there to produce so eloquently, perfectly, so amazing, our podcast each Tuesday. And we look forward to having you join us here in the studio. We've got some guests in the studio, guys. So without further ado, I just want to say, if you have photo productions, movie production, any kind of photography, videography, movies, documentaries, anything in that sphere, you call on APAT Media, the premier space for that. So I would just simply say, reach out and touch. We're only a call away, an email away. Our email, by the way, is info@apatmedia.com. That's A as in apple, P as in Paul, A as in apple, P as in Patrick, media.com. We're not going to bore you anymore because we've got an amazing guest in the house, and we are just bubbling over with joy that he would come all the way, over an hour away, Sharon, to join us here in the studio. Yeah. We are so grateful. We're so thankful to see this fresh, young, smiling face here with us. And I know so many would be ecstatic because he's none other than Dr. Deitrick Cox. Welcome to Speak Harmony and APAT Media.
But we didn't get to chit-chat first.
Girl, look, I'm just rushing because I want to get into it. I just want to get into it because I'm so curious. There's so much. Yes.
Okay. So how was your weekend, my sister dear?
Don't let me tell folks what I did this weekend. It was great.
I will tell folks what you did this weekend. We were partying.
Mr.
Yes,
P?
we were.
Mr. P, hide me out behind the microphone, please.
And
block my face.
We had a good old time at the Atlanta Jamaican Association party.
Oh my God, yes.
Yeah, we were dancing up and down.
Who was dancing? Who was that?
Yeah, somebody I know was.
That wasn't me. It wasn't me. I plead the fifth. It wasn't me.
So that was AI.
It was AI. There you go. It was my AI sister, Shirley.
And I always come with the national day. And there are several national days, Mr. Cox, all the time that we talk about something. I pick out one that I think is interesting. And this one is fitting. Today is National Christmas Card Day.
Ooh. What's that?
So, Sir Henry Cole, he was a member of the British Civil Service, and he created the modern concept of Christmas cards, along with some other friends of his. The first card was sold for 1 shilling. You know what a shilling is?
Mm-hmm. No, I don't. Don't try to age me like that. Don't date me.
I remember shillings.
I heard about it.
It's about 24.
In my history class.
It's about 24 U.S. cents. And by the 1860s, the practice of sending Christmas cards was more or less a full swing in Britain. And then, of course, thanks to the advent of printing, the printing press and so forth, Christmas cards reached the U.S. And by the 1840s, close friends were sending printed cards. And then the practice really took a good turn back in 1875, and there was a German printer who decided to say, hey, got together with Hall Brothers, who opened Hallmark. Mm-hmm. Did you know that?
Oh, yeah. Once I heard Hall Brothers, I knew,
opened the Hallmark. And then 20th century, guess what? Yeah. It's history, right?
Yeah. E-cards.
E-card. So I was going to ask.
If they do e-card, there's some folks who do.
I was going to ask you, do you do digital cards?
I do. Absolutely.
Really?
Oh, yeah. And I get them and I send them out.
Really?
Yeah, they're pretty
effective. Is that
effective.
text or is that email?
E-cards. So we just send out, pretty interesting. Yeah,
All right.
I got with that one because
Do
I'm
you
not
send
too
out
tech.
Christmas cards by hand?
You know what I do, and it's so funny. I have a box that I always use, and I've done that for years, and so I have a box of cards that I have gone through, and I still have my black book. The good old faithful black book. I still have
Really? Does
mine.
your husband know about this black book?
No.
It's right there.
Does he know about this black book? That's what I want to know.
It's in my box with my my Christmas my cards. I still
Little
send
black
cards.
book.
I'm boring
I'm gonna
that
have
way.
to ask him about that.
Oh look.
I'm joking, but that's good.
After what, almost 22 years of marriage? I don't know.
Yeah, but it's in the box.
It's in that box. Oh, it's in that. She's starting.
I'm creating trouble. Let me be nice.
First, she started with what I did this weekend,
Right.
and now she's.
So let me be
Sharon,
nice.
what did you have
secret
for lunch or dinner?
So, Dr. Cox, do you
a
give
good
out
lead.
Christmas cards?
No, I can't remember. Well, I will say depends on the Christmas list. I try to make sure everyone is accounted for. So yeah, typically I'll buy a box of variety cards and get those out to folks I can't deliver to in person. So
how
that's
sweet.
usually the time that I'll do Christmas cards. I can't say I think of Christmas cards as a go-to. I'm always thinking of more wrapped gifts, but there are times that I will grab a Christmas card off the shelf and mail it out to a loved one. So yeah.
I'm always late, so I'm looking for the Happy New Year card. That's what I'm guilty of. If I'm doing it physically, I'll just text someone Happy Holidays and be through.
True. You know what? It really
Yeah.
takes. Let me tell you, that's true because it takes that burden off you. And it's not a burden really to send out cards. But, we grew up doing that.
Yeah.
I am still
much fun.
that person who likes to receive cards.
Yeah.
So I got my birthday was in October.
Okay.
I got a birthday card in November, and I was ecstatic. I opened it up. I thought it was an early Christmas card, and when I opened it up, I giggled to myself because that was a sweetheart friend of mine who sent me my birthday card. She mailed it in November,
Oh wow.
but she wanted me to make sure I got my
Got
birthday
your card. That's good.
And I was like, you know what? I'm good with that. 'Cause
Yeah.
it's like books.
Yeah.
It
Right?
is. You
It's like
keep-
books.
Yeah,
I mean, the
have
audibles are
yeah,
great,
the
but
words that are
yeah.
touching, I keep those
I want to
cards.
thumb through my pages. I'm still that old-fashioned girl who
Yeah.
wants that kind of stuff. So,
Yeah.
wow. But guys, we're in for a treat. We're really in for a treat because we've got none other, like I said, than Mr. Dr. The most amazing. You came so highly recommended.
Yeah.
And she is kind of on her way here.
Yeah.
Not happy at all because she wanted to be here before you.
I know.
And let me tell you, traffic. Oh, Atlanta traffic. What a joke.
Yeah.
So she called me, must have been about 100 times. And I was like, Michelle, it's okay. When you get here, it will be just fine. Dr. Cox will be here.
Yeah.
But she is that person. She
Yeah.
said, she said this to me, oh my God, over a month ago. She says, you've got to get Dr. Cox
Yes.
on the podcast.
Yeah. Yeah.
Pretty much like a threat. I'm serious.
Right.
She says, you've got to get him. And I was like, fine. And so we got stalled out a little bit, but here you are.
Yeah.
And so we're not going to keep the audience in suspense anymore. So I'll give you a little snippet about Dr. Cox. So Dr. Cox specializes in traditional and innovative regenerative, interventional, spine and non-surgical orthopedics. After completing his undergraduate studies at Amherst College, our friend's son went there and he's quite the brilliant one. Christopher, shout out.
Nice.
Dr. Cox attended medical school at, drum roll right here, Morehouse School of Medicine.
Morehouse man.
Morehouse,
All right.
yes.
There you go. Absolutely.
And so, yes, I love it. Upon graduation from medical school, he completed his internship through Harvard Medical School at Cambridge Health Alliance in Cambridge, Massachusetts. Then returned to Atlanta to complete his residency in physical medicine, rehabilitation at Emory University. He is a board-certified physiotherapist, I almost went there, by the American Board of Physical Medicine and Rehabilitation. Wow. For over a decade, A decade where? You graduated when?
Decade and a half, actually.
Oh, stop it. No way.
Okay, baby
Oh,
face.
yeah, baby face. Oh, Dr. Cox provided exceptional spine and musculoskeletal care to patients in Metro Atlanta. His goal for his patients is expedient functional independence. Dr. Cox specializes and prioritizes patients' education and patient autonomy. Through personable and informative discussions, he guides his patients to the appropriate treatment plan for their specific condition. So, in his spare time, because he's married with 4 amazing boys.
What's up, guys?
Dr. Cox, wow, I'm tired. And their ages range from 12 through 5, right?
4.
4. Lord have mercy. Yes. God bless you. Okay, so you've gotten all these memberships and recognitions. I'm going to scan through them because folks ought to know about you. They can research you as well. He sure did. You top notch. Your parents must be so proud. Your family's so proud.
They are.
Because you're a fellow American Academy of Physical Medicine and Rehabilitation, National Medical Association, certified provider, United States Department of Labor, Office of the Federal Workers' Compensation, and nominee of Atlanta Magazine's Top Doctors in 2019 to present.
There you go.
Speak Harmony does not play. We've got the best of the best up in this place.
Yes.
Okay? And this is how honored we are to have you here. Thank you for coming in, and thank you for sharing your time and driving all the way from over an hour and more just to get here.
It's
We
Atlanta.
appreciate you.
Yeah.
So
These
appreciate
days,
you.
we used to say 20 minutes. Now, if you say
Down the road.
No, if you say 60 minutes,
Yeah.
it's an hour. We're like, okay, what's that?
Yeah.
right?
Yeah.
It's regular.
Yeah.
Amazing.
So
Sharon.
what led you into even starting in the medical field with orthopedics?
Yeah, absolutely. So, first of all, I want to say thank you for having us here. You guys are top notch. If you're watching, you need to come and check the studio out. It's it's the bomb. So, really appreciate being here. Been looking forward to this. Was elated to get the invitation a couple of weeks ago, and made sure that the schedule was perfect, that I could get here early. As my old band director used to say in high school, early is on time and on time is late. So I was pushing through the traffic to get here. People ask me this question quite a bit. I've always been a student of math and the sciences.
Yeah.
In high school, I was very close to some administrators. Well, some administrators took a special interest in my career path, and so forth. So they introduced me to my very first mentor in medicine. I had aspirations of I'm from Leesburg, Florida, which is just a little bit north of Orlando, and a lot of my friends, obviously, who were going to go to the next level in college, where the talk was always Florida A&M, and so likewise, I thought about that, and pharmacy and great schools in general, but I also had other interests, and that's what I tell everyone: have multiple interests. I really wanted to be an engineer, truthfully. I love function and the way things work, but I also love people. That's why I'm here tonight. Love conversing and sharing with folks, learning from their experiences and so forth. So this administrator, she was an assistant principal, and she introduced me to a young African-American physician or orthopedic surgeon who had just come into our small city by the name of Dr. J. Mandume Karina, and he still practices there in Leesburg and in the villages. And so we had a really good relationship. We met, had dinner, told him what I was interested in, and obviously was able to see his lifestyle, what being a doctor meant, trying to also got a view as to the type of commitment it takes to stay balanced when it comes to work and life, especially with the
Is that
demanding
such a thing,
field.
really?
Well, you have to make it happen,
Yeah,
and
you
so
do. Absolutely.
and that's what I continue to try to do on a daily basis. Get in what I feel and what I know is the right amount of work, the right amount of effort, the right amount of energy and preparation, so that go home and do the real work of of taking care of family and friends and loved ones, and so anyway, that physician. Was a graduate also of Amherst College.
Wow.
Some years, about probably 20 years before me. Sorry to put his age out there.
Fine, no.
But he asked where I was applying. I was sort of applying all over, actually, in state, out of state. He got wind that I was kind of toward the end of my applications for Princeton, and I can hear his voice now. He's like, dude, don't go to Princeton, go to Amherst. I was like, what's Amherst? He was like, look, not many people know about it, but I'm going to clue you into it. And so anyway, had some exposure to a couple of different fields. Engineering was bored out of my mind, but I probably didn't get the best experience. Shout out to all my engineering friends out there. I'm not putting you down. I just think I got paired with a bad career day host. But when I got to Amherst, and I was always told that in order to enter into medicine, there are many paths into medicine. My mentor was actually a fine arts major. I think he was a fine arts and biology major, but the Amherst appealed to me because it was an open core curriculum, so we didn't have required courses, so we had a lot of double and triple majors. And so you could study all over, and I was always told, even before high school, hey, if you do decide you want to be a doctor, I know you're thinking pharmacy, I know you're thinking engineering. If you want to be a physician, don't think you have to go and you have to major in chemistry, you have to major in biology. And that's one of the things I wanted to share is that you can major in pretty much anything as long as you complete the required courses. So, and so he made it very clear, hey, if you love biology, major in biology. If you don't, then don't go through biology just because you want to go to med school. Do what you want to do. And matter of fact, your odds of getting into med school are higher if you are a non-science major. A lot of people don't know they did.
Really?
Absolutely,
No
100%.
secret.
Yeah, yeah. So I'm gonna drop all the secrets on that tonight too. So yeah, absolutely. And for a lot of different reasons, academically, your ability to relate to different individuals, personal ability, experience means a lot, right? And so after I did a stint, I think my second semester is when I really got serious about my pre-medical courses and started taking those. My father arranged for me to attend what's called a Health Careers Opportunities program at Meharry College, and we stayed on the campus of Fisk. And very great, highly recommend this outreach program. There's also MMEP, I believe it's Minority Medical Education Program, if I remember correctly, that kind of targets minorities who are interested in the sciences. And so we actually shared the space with them. And I was able to shadow an emergency medicine physician there. I think it was Metro General Hospital there in Nashville. And that's when I was really bought in to say, hey, I want to go this route all the way. So that was my path to moving towards studying for the MCAT and saying, yeah, I'm all in, no more engineering. I want to get into med school. So sorry for the long-winded answer.
No.
That's my path.
Because folks are watching this and they want to know. And there are students, their parents also. And, I just literally said that, I think it might have been earlier today or yesterday. I know it was recently that it was today. And I said to my friend, I said, college is not for everyone. I maintain that because there are folks who, they're great at what they do, and whatever it is. Martin Luther King said, whatever it is that you do, be the best at it. Yeah, and I believe in that. And if parents would just get that, yes, you want your doctors and your engineers and all these, top-notch, requirements and stuff that you want for your dreams and aspirations that you have for your children. But you know what? If your children, for example, I know someone who wanted to be a chef.
Yeah.
And his father was an electrician.
Yeah.
And his father insisted, this is my boy, this is my firstborn, my only boy, he better be an electrician. And guess what? He went to college for 5 years and didn't finish college. And his uncle said to him, what's the problem? What seems to be the problem?
Right.
Yeah.
And you know what he said? He says, I don't like what I'm doing. He says, well, why are you there? He says, well, my dad. And he says, no. His uncle said, I give you permission to leave. Just get up and quit and do what you enjoy. That young man started baking and cooking and cooking and baking. And today, he cooked for the Marlins. He cooked for the Miami Heat. He cooked for the Falcons.
Yeah.
He's doing his own thing right now. So a lot of parents really live vicariously through their children.
Sure.
And these professions that they have in their heads only, that their children should be this path, on this path only.
Right.
And I'm not disrespecting parents. I'm just simply saying work with your children.
Yeah.
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 Seek it out, because it may, there are children who are very good with their hands.
Yeah.
I know young ladies who are braiders. I did not braid to save my life, but I know young ladies who would do a braid. And it's like, wow.
Yeah.
How did you
Absolutely.
do that? And so they make great cosmetologists, and they make a whole lot of money than a lot of people sitting up in those corporate offices.
Yeah.
So I say, just guide your children. And what your father did, that was amazing.
Yeah.
But there are children who don't have fathers and father figures in their lives, and that's why we need people like you, Dr. Cox, mentors,
Yeah.
and the mentor
yeah.
that you had that pushed you into your destiny.
Correct. Absolutely.
And so we shout out, your
mentors,
mentor.
yes.
Yes,
Yeah.
yes,
So
they are
very
it's so critical.
Yeah, 100%.
So critical.
And on that same note, with that mentor, he never said, "Hey, this is you have to go to med school or do what I did." He just presented an opportunity, and I think that's really what we need are opportunities, because very few of us choose the exact same thing. I mean the thing that we end up doing from on the first go round.
Yes, sir.
I don't think it's supposed to be that way. And so I think exposure is what I tell patients.
Taste.
I mean, patients. I'm sorry.
Of course, I know.
My friend, sorry, I'm just coming from work. That's what,
It's okay.
so that's what I tell a lot of folks who request knowledge from me. Hey, what path and so forth. I say it's more important to find out what you don't want to do. Like to that point, expose yourself and say, hey, I definitely can't do that. Like for instance, no joke, I know a profession that I could probably never do. Not because it's great work, but my mind isn't wired this way, and that's that of a server or a waiter, to be able to hold different all that knowledge for each and every individual.
Yes.
I mean, that takes a great. I mean, I'm really awestruck when we go to restaurants and we're like,
How
you're
do you
holding
remember all
down
that?
like 12 orders, and you know exactly
And the tables.
what and it's
And where they are sitting.
Yeah, and so that's really the most important thing is exposing. Hey.
Yes.
Check this out. If you like it, great. My mentor is the same way. He didn't go into medical school thinking that he wanted to be a orthopedic surgeon. He just happened to he looked into a surgery suite, came in and said, what are you guys doing in here? Oh, this is orthopedics. I like that.
Oh,
and then
really?
went on his way. And similar thing for me in finding the profession that I'm doing right now. So exposure and ruling out, that's a big word in medicine, but you build a list of possibilities, and then you start saying, okay, pros and cons.
Yeah.
I don't like this. This one outweighs that one, and then you find your way to where you are supposed to be. I'm a firm believer in that, but you got to have the opportunities. You got to have the exposures. I'm glad I had that 3 hours with those Lake County civil engineers that bored me to death and didn't say more than 5 sentences to me, because I could have been an engineer. Like, this is not what I wanted. This is not how I pictured it. So exposure is the key, is in my opinion. So
Wow.
So you must like sports. Sorry.
yeah. No. Oh yeah, absolutely. I'm big on function. This is my sports medicine coat. But just the way the body works. Like I say, I was interested in engineering. I love, probably my favorite subject coming up through high school was physics, and even in college to this day, I'm constantly thinking about physics. And so just one correction to my bio. I think it was mentioned that I was a physiotherapist. So what I am is a physiatrist, and we can talk about that. Now, most people, I know I didn't know what it was. That? I was in medical school. I didn't know what it was until literally, like I said, just those fateful interactions and crossovers with folks. There was a physiatrist literally just popped into our room when we were studying in our study room and say, "Hey, have you heard of physiatry?" I was like, "What is that?" I'm sure. Yeah, so yeah, absolutely. I'm sure you guys are familiar with it too, and Michelle. So physiatry, the root word obviously is physical or physics and so forth. So it's the medicine that focuses on function, from the way a person walks, what type of shoes you should wear, sleeping posture, sitting posture. How can we optimize function? And so we are relatively new to the medical field, and by new I mean like 1940s, whereas most of the other specialties go back centuries. Correct. And what was happening, you've seen the old war movies where you come back with an amputated limb, there's spinal cord injury. Those folks, because of lack of function or restoration or adaptation, they didn't live long. It was something, they would succumb to infection, poor wound care, poor pressure distribution. We all have loved ones who are in care facilities where they, you have to be turned so often or else, and they were succumbing to those very injuries. You didn't see wheelchairs, you didn't see spinal cord. So every time you see a handicap parking sticker or space or something that involves federal recognition and privileges for the disabled, you should think of us, because the physiatrists, we're the ones who were behind the legislation for the Americans with Disabilities Act.
Well, thank you.
Interesting.
Yeah.
Thank you so much.
Every time you're building out a house and it's like, why does the corner have to be this many degrees? Why does the turn radius have to be? Why do the doors have to be a certain? All of that.
Inches.
There you go. All of that was planned out through our specialty. So, so anything. So that was so as veterans were coming back from World War II, a lot of primary care and neurologists came together and said there has to be a better way for these people. You can't become paralyzed or have a amputation and then that be a death sentence for you. How can we not find a way to help these folks function? And so collectively they came together and made up the discipline of physical medicine and rehabilitation, or physiatry for short. And so it's expanded, into anything from care for spinal cord injured patients, brain injured patients, all the way over to sports medicine. So anything that deals with function, how one walks, like I said, ergonomics, all of that is birthed out of our field. So that's in a nutshell. If something's not working, something needs to be fixed from your musculoskeletal or neurologic system, we're the ones to come to, and we do everything within orthopedics and neurology short of surgery. So so that includes pain injections, regenerative medicine, which I'm very, very deeply invested in. So it's a wonderful field. I still feel like a physicist in a lot of ways as I'm practicing and as I'm coming up with ways to make my patients better.
Interesting. So, hey, shouting out Super Peck. So he does, they do a show here, a podcast on Monday nights. So that's one of our jocks here.
Okay.
And there's Tom Jack. He says, great advice, Dr. Cox. I'm not sure who that is, but it's got to be one of your fans, your patients, or someone in your network. Because
what's up, Tom?
I knew it.
Tom C.
Yes. Dr. Cox, amazing information. And you know what? we're going to be taking a little bit of a break
Yeah.
to come back because there's some questions that we have for you. And I'm sure we've got folks in the audience who do have questions for you as well.
Yeah.
So we're going to take just a second to break, and we'll be right back.
Absolutely. Thank you.
Thank you. Welcome back. And honestly, Doc, we've got so many things going on here in the ATL. We're we're trying to catch up to ourselves, and God gave us 5 weekends in this month. But guess what? That wasn't enough.
Yeah.
We could use another 5 because when I tell you that we've got back-to-back events, it's crazy. This past weekend alone, like Sharon mentioned, we had the Atlanta Jamaican Association event, and that was their holiday party, their Christmas party.
Yeah.
They're the oldest Caribbean association here in Georgia,
wow.
almost 48 years old.
Okay.
And look, there are high school alums. I mean, there's so many different people. I mean, we have another group called the Integrity Children's Fund.
Yep.
I mean, you know about, right,
Oh, yeah.
that's right.
Yep.
Oh,
Yep. I'll
see?
be there. I'll be there.
You're gonna be
See,
there.
I love it. I love
Yep.
it.
Yep.
We're
Yep.
going to be there too.
Sponsoring
But
too.
it's,
Yeah.
yeah, that's right.
Uh-huh.
Thank
Yeah.
you.
Uh-huh.
You're
All
amazing.
right.
Yeah.
So we're shouting about, but as we come back, there are folks who are watching and they're going, we're just thanking God for people like you because you said something that struck a chord with me. And it made me a little emotional because you said folks would come back from World War or have accidents, for example, and they're pretty much discarded because what do you do with this? Doctors didn't know what to do with them. I mean, an amputee, now what do we do? Because we weren't that advanced.
Yeah.
Just wasn't there yet.
Yeah.
So, regenerative. I mean, there are folks who are watching and they're wondering, what does all of that minutiae, whatever it is, what does that mean? I mean, because put it in layman's term for us, please, because I didn't go to med school, okay?
Yeah.
And I read a lot, I research a lot, but there's a lot of stuff that just goes right over my head.
Sure.
And so for the layman that's watching, break that down to them. I mean, and just give them a snippet of precisely what you do. I mean, it's a lot that you do.
Sure.
Just give them just that little piece of it. Yes.
Yeah.
Regenerative part of it. I can't even say it.
I know. Yeah, I've been fumbling over it too today. But yeah, so our bodies, we're designed with certain repair mechanisms, right?
Yes.
We cut our hair, it grows back. We clip our nails, they grow back. We have an injury, we have a scar. We have a laceration. Our body is able to come together and heal those things. But with time, our ability to those natural regenerative processes are outpaced, unfortunately, by the degenerative processes, right? Wear and tear, life, stress, activities, genetics. So all of those things play a part in these are two forces that are, fighting against one another. And so as we get older, one outpaces the other. So what we try to focus on are using the body's natural or activating the body's natural mechanisms to promote healing. Inflammation, contrary to popular belief in a lot of pharmaceutical commercials, you see inflammation has positive benefits. It's the way that our bodies heal.
Yes.
And so there's actually a lot of research coming out now that, hey, if you sprain an ankle or you have some type of musculoskeletal injury, let's see what your body can do first. Maybe some ice, but before you go and pop the NSAID, the over-the-counter things, let's see what your body can do to heal itself. So I think of inflammation the same way of in terms of its positive benefits as a fever, right? No one wants to have a fever, but there's some comfort in if you have a fever, you say, hey, my body is fighting something.
That's right.
My body is able to generate a response, because as we know, I grew up in the 80s. And so growing up, all you heard was like, this autoimmune disease this deficiency, this immune deficiency that was, crossing the globe. And folks were sick and didn't know they were sick. They weren't even mounting fever responses. And so that's a bad place to be in when your body's natural fighting mechanisms are shut down. So regenerative medicine, to get to it, is that we can put together things from our own body. The most common of those being platelets. Platelets play a huge response. They are often inhibited by things like aspirin, Advil, all of the over-the-counter agents, except for Tylenol, which is not an NSAID. The simple process is that if a patient comes in, let's just say they have a meniscus tear or degenerative knee joint, their cartilage is damaged, we can draw their blood and we can isolate through centrifuge the plasma components from the red blood cells. And we will take that plasma component along with what's called a buffy coat layer, and those platelets are injected into those areas and creates an inflammatory response. And so to the body, it activates and it says, hey, this is you can make an old injury look like a new injury. So it's almost like doing a do-over. Hey, that didn't turn out right. If you're a sketch artist, hey, scribble, erase it, scratch that. Let's start with a fresh canvas and fresh materials. And so we're able to do that with platelets. We're able to, there's another therapy called Prolotherapy, where it's a irritant mixture that stirs up local cells. It's not quite as strong as PRP, but it helps as well. And then there's one of our probably most effective treatments is actually taking unmarked cells called Wharton's jelly, and those are spongy cells within the umbilical cord that protects the umbilical vessels between mom and baby. And so those are undifferentiated cells. They have the potential to become whatever's in their environment. And so we see both PRP and things like Wharton's jelly being used in as simple things from head to toe. I can go down the list. Follicle stimulation and regrowth for hair loss or thinning hair, as opposed to Botox. Folks are using PRP. You go to a lot of aesthetics and plastics. Anti-aging, exactly. Right. So instead of, whereas they would have done Botox, they're now injecting PRP, Wharton's jelly into those areas.
Stem cell?
Well, I'm glad you brought that up.
Yeah, 'cause that was my question, because he kept saying cell, and I'm like, I was about to, yes.
For all intents and purposes, yes, but we that's not a word. We don't use that in our practice, simply because stem cells in the U.S. are not FDA approved. So we don't see, you won't see anything that says stem cells on our website. There are certain exceptions to that. Certain blood cancers and certain and an autoimmune disease that it has an indication for. But outside of that, pure stem cells. Now, if you're speaking of your own cells, like for instance, this is not as popular as it once was, but you can take your bone marrow. You can get a huge bore needle into the bone and kind of pull bone marrow cells out and inject it. Yeah, very painful. I guess that would count as what some would say stem cells. But the beauty of what we do, like I say, with PRP, a lot of people love that because it's coming from your own body. It's
course.
you're
Of course,
able
it's not
to
a foreign
exactly.
topic.
You're
Foreign
able to be
enough,
efficient,
yes.
almost like any ecologist. You're able to salvage and use what you already have and make it work.
Promoting the healing process even quicker.
Correct, 100%, and with less risk, right? I
Right.
mean, you're not allergic to your
yourself.
exactly
Totally.
Yes,
right,
yes.
exactly. So that's a popular first start, and it's very very helpful for a lot of folks too. So yeah, that's in a nutshell. That's what we do at Regenerative Orthopedics Center. So
Sports. So I'm gonna segue just for a little bit because sports medicine. I mean, did you play sport? Give me 1 second. Because what up, Tom? Great advice. It says. I mean, oh my goodness, they're blowing us up. Plan in motion, because you are a gentleman and a scholar. Be proud of who you are.
thank
And
you. Appreciate
listen,
it. Oh,
that's
thank you.
amazing.
Thank you.
No
So no
more
one is
rice.
asking for no more rice, rest, right? Which is
Right,
an
right,
acronym
exactly.
Yes.
for rest,
Yes.
you got it. You got it.
compression, rest, ice.
There you go.
compression,
There you
and
go.
elevation.
There you go.
Yes.
No more rice.
Well,
ahead,
I'm not against rice, but again, we have some things that can supplement that quite a bit. So yeah,
Really?
yeah, with the regenerative procedures that we do.
I have a question.
Yeah, go for it.
So access, because I'm listening to everything you've said
Yeah.
so far,
Good question.
and that always comes down to, question for me. Access is always a thing, and we live in this amazing, great America, this great world. Because most Americans think this is the universe right here. There's no place else outside of here. And what's a shame? Yes, it is. And I said it on Speak Harmony podcast because that's what we do. We get information out, but we speak truth.
Yep.
And it is such a shame, Doc, that there are folks out here. And again, it breaks hearts because they don't have access. The only thing that's stopping them from healing, and like you said earlier, they don't have to die or they don't have to suffer.
No.
They don't have to suffer.
No.
And so there are a lot of vets that have come back from the American wars. They've come back. They've fought for this country.
Yep.
And they have come back here. They live on the streets.
Yep.
They're amputees. I mean, I've seen so much of that. And it breaks my heart to see that because most of them are not able to see someone like you.
Correct.
They can't afford to. They don't have health coverage. They don't have coverage at all. And, they may go to one doctor and they're thinking, okay, fine. For those that have access and simple, they may decide, you know what, I'm not comfortable with what they shared with me. But they can't afford to get a second opinion like the folks that have it,
Yep.
the 1%.
Yep.
And so it bothers me. I mean, are there any preparations or any provisions being made to accommodate these folks where you're concerned? I mean, and I can probably answer that question, but I want you to do that. And I'm sorry to put you on the hot seat.
I cannot believe you just asked that question. It's almost like you were planted here. And by the way, we didn't do any prep for any of this.
No, at all.
We're flying off the cuff. And so,
Yes.
but yes, so one of the things that we offer, if you were to go to our website, there may be and that's www.regenorthocenter.com. I'm trying to stay on track, but it's so much I want to leak out. So a lot of folks believe that a doctor and a physician are the same thing, and I make a distinction. As my buddy who gave a shout out there, Thomas, he'll know we were huge Latin students back in the day. So, your doctor comes from the Latin word docere, which is to teach, right? Now, the physician, that's the actual putting the knowledge in action and motion. And so I contest that we have too many folks who are being physicians and they forget about the docere, the doctor part of it. So you have to do both. So you'll see a lot on my website, and when you come to my office, you'll see a lot of you won't see me coming in and out of the room. My goal is when you leave is for you to be more educated about your body and your options versus when you leave. So access and cost, to that point, to your point, one of the things that we do at Regenerative Orthopedic Center is that we offer, we prefer that they be in person, but we offer free PRP or regenerative medicine consultations. So if anyone's listening, you could shoot me your MRI, your X-ray, just a simple conversation over the phone. They're slated for 15 minutes. If there's no one waiting in a room to be seen, sometimes they go yeah, exactly. So I'm not tooting my own horn, but when I get to talking about things I love, before I look up, they're banging on the door like, hey, it's been 50 minutes for this free consultation, which I don't mind because I want, exactly. Yes. So just arming them with the knowledge, that's one thing. And like we said, I'm an hour from here. I went from North Atlanta to East Atlanta, an hour and 22 minutes to be exact in this traffic. But we offer even online, televisits as well, or teleconsultations for free as well. And other access points are we accept, Medicaid, Medicare. Most clinics that do regenerative medicine, they're going to say, they're picky even with commercial insurance. There's like, oh, Humana? Oh, no. Or, hey, we don't take any Blue Cross Blue Shield. I wanted to make sure that everyone had access. So much so, you'll even find a MARTA link on my website. I wanted to make sure that when we started praying and looking for where we wanted to be, we wanted to say, hey, we want to be on MARTA. You can get off MARTA if you can get to MARTA. MARTA isn't everywhere, but if you can get to MARTA, it just opens up a lot of the different corners of Atlanta to be able to come to Alpharetta, and you're right at our doorstep. So we're big on access.
That's making me very, very emotional. I can't help myself. I can't help myself.
Yeah.
So,
that's a blessing. It's a blessing. Yes.
You touched on something a little earlier, Dr. Cox. I was curious on what are the most common treatments for orthopedics?
Yeah.
What are the most common ones?
So, if you're dealing with non-surgical issues, things that don't require urgent surgery, avulsions, fractures, dislocations, typically you're going to start out with conservative treatment, physical therapy, home stretches. We just talked about the Hinge Health network and so forth here. So there's some things that you can do to, because 80% of patients, that's all they need.
What do they come to you for?
Oh, what they come to me for? Anything. The
most common ones.
Most common are probably spine. So we see a lot of spine. Yep.
Because I think when people think about ortho, they think about legs or back.
Yeah.
And, some type of
joints
physical
and
therapy.
and stuff like that.
Yes.
Yeah. I would probably say knees and spine is we see a lot.
And that leads me to another question where when you said knees and spine, I was reading, and it's just me, and it's not a conspiracy theory.
All right.
So let me put it out there.
Go for it.
But, I think of it and I'm like, oh my God, for this year alone, 2025, and it's not done, I've known people doing back surgeries, knee replacements, this replacement. They've like a car, pretty much. They've replaced all sorts of parts.
Yeah.
So you can get spare parts now for the body, pretty much. Body spare parts. That's what it seems like.
Yeah.
And I sometimes wonder, because I have a friend who did back surgery, and she's doing excellent.
Yeah.
But then I have another friend of mine, family member, who did back surgery. And she's not doing well.
Yeah.
So, again, access is everything. It's key, because if you went to your doctor and got a first opinion, this is what they say, this is the diagnosis, and then you said to yourself, I don't want to do that back surgery. I don't want to do that, whatever it is.
Right.
Most people don't have the wherewithal or the funding, let's be real, to go to get a second opinion. So in other words, you know what, I might as well it's a trial and error. Let me just try the back surgery and see if it was going to fix what's, ailing me, what's going on with me. and it's almost a gamble. So a lot of people gamble with their lives on that,
Yeah.
in that regard, because they're saying, if I fix this, again, it may fix everything and I'll be fine. I'll be good to go. I'll be like new. But then there are other people. And I'm thinking maybe it's, and this is just me, so you're going to tell me because I'm not the doctor. What could be? Could it be a dietary issue that would one person over here do back surgery and it's successful? And I know it's a very open, weird kind of question.
Yeah.
And then this person over here does the same back surgery, but they're just thrown. I mean, could it be could it be their health that's, getting in between them being healed and, this being a success as opposed to the other?
100%. So
a lot of questions in one. I'm sorry.
Yeah.
But,
I would probably have to say it has to do with like operator efficiency or operator error is what it comes down to. So, and that's just from the physician standpoint, right? Or the surgeon standpoint. Patient selection is key, right? There's no one size fits all. And you you always want to, for something that's permanent like surgery, you want to know that you're with a physician that cares about results over volume. That's the key, is what I see a lot of times. I tell folks who come to see me, hey, you can, if you want to, there are surgeons, I don't personally know the first example, but there are folks, if you really want surgery, I can send you to someone that's more than willing to cut no matter what, regardless of the results. But a good surgeon and a good physician in general, they care about their results. There are physicians that I've been blessed to be able to, surgeons specifically that I've been blessed to work with, where they want to know that you have done everything possible before they make a major decision
Ruled
like
out
surgery.
everything,
Exactly.
yes.
Have you done this? If you go to the right person, like let's just take back pain, right? And so part of what I do are injections into the epidural space, various joints of the spine, top to bottom, right? And usually if you go to the right spine surgeon, they'll ask you, the first question they ask you is, two questions. How much physical therapy have you done? How many injections have you had? If you say nope and nope, he or she'll say very quickly, hey, go do that. Come back to me if that doesn't work. Try everything possible, because if I'm going to put it's the issue of pride too. They say, if I'm going to put my skill set to work, if I'm going to intervene and now my name, my status, my reputation is attached to you moving forward, I want to make sure it's good. I want to make sure there's a good report. And not that everything always works out well. I mean, we live in the real world, but you can have the peace of mind in saying, hey, given the situation, given what was available, this was the best decision.
Yes.
All right.
And it was absolutely
You pulled out
Right. It was
Of course.
absolutely necessary. 100%.
So we've ruled out everything, and this is the
Correct.
only thing left for us
Correct.
to do. And that's
Correct.
So we've got some really, let me tell you, they're blowing us up here. Listening in from Florida, it says, I'm looking forward to seeing the channel. Oh, thank you so much,
Yeah,
Land
absolutely.
Nation. We appreciate that. It says, how far gone is too far
Treatment.
for treatment?
Yeah, I was going to
And
ask
then,
that question too. Thank
I
you
know
so
who that
much.
is. Thank you for that. That's our president of our ex-soldiers association.
Okay. Yeah.
Thank you. And he's got some recommendations for you. So go ahead.
Yeah.
How far gone is too far for treatment?
I'm assuming they're saying, hey, is there a point to where these regenerative services or even my field, you're beyond the point of
Help.
of being helped? There's a simple answer to this, and there's a more complicated answer. But I don't believe that there's anyone that's beyond. The simple answer for me, I don't think there's anyone that's beyond treatment or care. Not that we get it right or that everyone has a perfect response. But again, if regenerative medicine isn't something you've tried, before you make a major decision, this is a stone you need to overturn and explore. I can tell you I've had patients who have gone and done the surgeries and come back and they're thinking, hey, this is my life. I pride myself on providing additional options, doing the research, even if it's out of my field. I believe that there is an answer. So that's the more complex question answer, I should say. The simple answer is, if you have an injury, and I'm assuming you're someone who maybe you're already undergoing treatment. Typically, if you have a specific injury, and let's say you're doing physical therapy or chiropractic, what I normally tell patients, hey, 4 to 6 weeks is, the research shows us, your whatever you've gained from that period of time, if you're 50% better, you're likely to stay 50% moving forward. If you plot out 24 months or what have you. So if you find yourself, hey, I've been, I'm a chronic physical therapy patient, you want to use those metrics. Hey, have I been doing physical therapy for 6 months, 8 months, 12 months? 4 weeks to 6 weeks at the most before you need to start making a change and coming to see someone like myself. I think that there's a lot of folks who feel like if they just continue to do therapy over and over again, that eventually something will break. But we need to put some additional options there. There could be aquatic therapy. It could be a specific physical therapy technique that needs to be ordered by us and work in conjunction as a team with your therapy team to get you where you need to be. So
the president, he also had another question there. He was saying that, and we will talk offline for sure, because he's concerned about ex-soldiers, disabled veterans and stuff that are needing help. Yeah. So there's so much need out there. There's so many needs, honestly. And so we're just going to do them in bite sizes. Yeah, sure. Because we're going to talk more about it. Yeah. But because time is of the essence, and we just got just a short time, I want to ask you, what's your advice for people who they're suffering from chronic joint and musculoskeletal pain? Those people, and they've suffered significantly. They've done everything, so they think. They've done therapy after therapy after therapy. Is that, what would you say is your, like, a window? When you say, we just fall off, we stop right here, and we go no further. Yeah. So Sharon alluded to this earlier, in the differences between someone has this surgery and that surgery. So I blame us first as physicians. Hey, it's our job. Hey, if diet needs to be addressed, it's our job to address that. If ergonomics or proper footwear, or what type of pillow you use, it's our job to direct them there. But there are, diet does matter. That's huge. There are other medical specialties that may need to get involved as well. There's a lot of folks who will come to me with chronic joint pain, as you mentioned before. Now, the veterans, that may be, it's pretty much wear and tear. That's straightforward. Yes. But we have a lot of patients who come, and that's another benefit of coming to see us, is I can look at this and I can say, hey, this sounds autoimmune to me, or this sounds metabolic. And so we need to get you to see an endocrinologist. We need to, we need a rheumatologist to weigh in. We need to get some autoimmune markers. We need to do a deeper dive versus just, hey, here's this steroid injection, and you're right back at the office in 3 months with identical symptoms. So I think that is something that definitely has to be initiated. Yeah. So we've got an audience member in the audience, and we're just about out of time. But we want to get her question in here.
It's more of in line with that question of how far is too far and everything, and it's more of a testimony for him as well. So my shoulder was killing me for years, and I've had physical therapy for more than once.
Do you want to just come over and speak into the microphone? We want to make sure that they hear this, Of
course, you got to put me in camera.
Yeah, that's right. We want to introduce this is Michelle Hill, who always watches, gives us guests. We just have to say thank you. We read your questions. So we just really wanted to put you on camera. Yeah. Come on around.
But anyway, I mean,
There
this
we
is more
go.
of a
Thank you.
testimony than a question.
All right.
But, you know, for years I've had this shoulder problem. I've had physical therapy for it more than once. And I went to him and I'm like, okay, this shoulder.
Dr. Cox.
To Dr. Cox.
Yes.
And he had, it was MRI.
Orthogram.
And he figured what it was. And I'm not going to say the word because that means I'm old. But PRP. And I'm telling you, I could not sleep for months. Could not sleep. And then I started sleeping. I didn't have to do this or this or this. And I couldn't do this. No, I can
Look
do
at you
this.
now.
Yes.
And yes.
Oh.
And then another thing was that I was having back pain and, you know, with legs problem. And the very good neurosurgeon sent me to do physical therapy to try not to because it was a cyst that was on my spine. And I went to him said, what can I do? And he gave me the right question to ask. And unfortunately, physical therapy made it worse. So unfortunately, I had to have back surgery. But with him having me ask the question. So when they said, how far is too far? Well, for me, physical therapy did not work. What what Dr. Cox recommended would not have worked because the doctor did think about it. He thought about it and he even, you know, spoke to another doctor about, you know, what Dr. Cox was recommending.
Suggested, yeah.
So, but unfortunately I had to have the surgery, but yeah.
And
But so, you know,
All right.
we have a GNF personal injury law group. We send our patients to him, and we have an athlete. She's a young athlete, and you know, he said, what was it? Aquatherapy. She's doing amazing,
Yeah.
by the way. She's doing amazing.
Yeah.
Okay. Well, thank you. Thank you so
Right,
much.
exactly.
for
Thank
that.
you,
Thank
Michelle.
you.
We
Thank you.
appreciate
You
that.
can split some of that money that you got.
Yeah, he's been-
Just a real quick question, though, because
Yeah. Sure.
one
Yes.
of the YouTube guests said, asked about rice.
Yeah.
And I teach
Yes.
CPR and first aid.
Oh, wow.
And so I'd like to know what would be the first aid, since you said we're not using rice, what would be a first aid treatment if someone wrist or ankle or something like that? Because I thought it was so interesting that how inflammation heals and that you don't have to pop anti-inflammatory.
Absolutely. So there are still. I didn't say we're throwing rice, throwing out rice, just to be clear. But what I was saying is more so on the anti-inflammatory side,
Okay.
and it does depend on. Again, it depends on the situation. If you're a high-level athlete, you're under contract. You may employ something like rice to get you going again if that's your livelihood and so forth. But again, where it's possible and you can afford the time to say, hey, I really want my body to naturally heal. Yes, if you're a week into an injury and it hadn't healed itself, it's okay to employ things like rice, maybe even an NSAID. So again, I'm not totally against that, but we're just so quick to say I'm in pain, let me get the NSAID, or hey, I got swelling here, let me get it down. But see if for those who are able, let the injury play itself out, take the rest that you need, make the modifications you need to make, and let the body heal itself. See if it's possible to do that. So that's my sincere advice to you.
I don't like this part at all, Doc. When I tell you, it behooves me to even go there, but I'm going to say this because of time. Share with the folks how they can connect with you, because I know my phone is going to be blowing up. Sharon, they're going to be blowing us up. How can we get in touch with him? He was amazing, and so tell the folks how they could reach you.
So you can reach us at Regen, that's REGEN, ortho, ORTHO, center.com. If you want to send us email inquiries, we are similar to your email address. It's info@regenorthocenter.com. You can follow us under Regen Ortho Center on our social media platforms, namely Facebook and Instagram. So we would love to walk with you and bring quality, as we say, bring quality back to your life.
Love it, love it, love it.
Thank you so much.
Thank you
We
so much
appreciate it.
once
Thank you for
again.
coming
Yes.
in. Blessing
Dr.
us.
Deitrick Cox, for your
thank you.
education.
Thank you so much for having me.
Bringing that and making sure that's the forefront of healthcare.
Yes,
And
absolutely.
and we learned the Latin terminology that Dr.
Docere.
means to teach.
Shout out to Miss
Yes.
Ogles.
All right, shout out for sure. And so we really appreciate you coming
Yeah.
and sharing with us. And we also appreciate
Yes.
APAP Media Group
Absolutely.
for sponsoring this show, and to our other sponsor, Heart Love Inc., who specializes in emotional and relationship management. So join us right here, every Tuesday.
Absolutely.
Okay? However, I did say every Tuesday, but there are, after the 16th, we're going to be taking a break. But we'll be back in January, so make sure you come back. But we're here live on YouTube, 7 to 8 Eastern Time, as we continue to learn from those who inspire us through action and purpose. Until then, keep speaking harmony into your life.
And just like, as usual,
Yes.
subscribe and share. And we'll see you next Tuesday. Have a good one.
Thank you.
Thank you.
Thank you for having me.
Thank you so much.
Absolutely.
They talk about health, they talk about care, sharing tips, they got us without a care. Thank you for listening, you're the best. See you next week to keep the best. Together we learn, together we grow. There'll be lesson every hour, we know. See you next week with more stories to tell. More